They are the first to answer the call when our lives are on the line. And now they are the ones in need of a lifeline.
The state of the EMS industry is on the verge of collapse.
From staffing to safety and supply chain shortages, COVID-19 leaves behind a trail of damage all over our economy. And for some first responders, these issues are adding up to the point that some emergency medical technicians are wondering, will their industry survive? News 5's Clay Lepard takes an in-depth look at ambulance entities sounding the alarm and the changes they say are desperately needed.
2 hours.
I was furious.
Cody Buskirk says it took 2 hours for an ambulance to show up at his mother's Parma rehab facility last month so it could take her to a hospital a mile and a half away.
2 hours of her just waiting there for someone to come get her. I mean, that was a death penalty right there.
He says she passed away as crews were loading her into an ambulance that fateful February morning.
I think that if she had been in the hospital when she had gone into cardiac arrest, I think that she wouldn't even gone into cardiac arrest. I think they would have been able to spot the problem as soon as she got there.
911, what's your emergency?
When a 911 call is made, you expect an ambulance to show up. What happens when it doesn't? It's a question Vince Gildone wonders more often nowadays.
I think EMS is in trouble.
Rescue 244, we're going to be out here.
When the pandemic began, his staff at Northwest Ambulance in Geneva consisted of 10 full-time EMTs and around 30 on-call. Today, that on-call auxiliary staff is about half, and Gildone says there's no new names at his doorstep waiting to join.
It's been a nightmare. It was a career path before, and now it's not being looked at as a career path by most people.
It's an industry that nowadays pays about the same as some fast food restaurants. On top of people not liking the pay, Gildon says people didn't like being in close contact with COVID-19.
It's been ignored, and it's been shoestring funded for many years, and it's just COVID was the thing that pushed us over the edge.
And that frustration extends across the state.
EMS is in a bad place nationwide right now.
And from Delaware County to Jefferson County.
It's made it harder, for people.
To Shockton County.
It's going to get worse before it gets better.
And Dark County. These EMTs are placing their own calls for help.
If we don't do something quickly, I think that EMS as we know it is going to fall apart.
The issue, they say, starts first and foremost with funding, with much of theirs coming from reimbursements from programs such as Medicaid.
When I'm only getting $98 per call, it's hard to maintain a budget.
And keep in mind, those reimbursements, they say, only come through if someone is transported to a hospital, meaning if care is declined when an ambulance shows up, the ambulance company doesn't get paid.
We are almost treated as a trucking company. If a trucking company is not hauling freight, they're not making money. In EMS, if we're not hauling patients, we're not making money.
Right now, all 50 states classify police and fire departments as essential services, meaning they're required by the government, and as a result, those departments can gain access to additional funding. But when it comes to EMS, only 11 states classify EMS as an essential service, with Ohio being one of the 39 states that does not.
To think that EMS is not considered essential, I just can't even imagine, how that even slipped through the cracks at some point.
Eric Burgess estimates local EMS budgets only amount to about 1/4 of the budgets of fire and police departments. This coalition plans to lobby in Columbus later this year in hopes that lawmakers will put them closer to a level playing field with other first responders when it comes to attracting new talent.
We're not bringing new people in fast enough to replace the people as they're leaving.
A cycle of problems with the power to pummel a profession.
Until we can fix the reimbursement issue, we can't really get our wages where they need to be, and until we get our wages where they need to be, I'm not sure how we're going to attract people into the business.
If that's the case,
I don't want people to just brush this under the rug.
Then Cody Buskirk worries more will end up like his mom, Deneen.
We should be confident that we can call an ambulance and they'll be there for us when we need them.
In Parma, Clay Lepard, News 5.